your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here with Zach today. Zach is a personal trainer. You're just at Powerhouse? Or
just at Powerhouse, correct,
too?
yes.
Okay, so he's at Powerhouse in Newton, kind of a newer gym. They opened in March, I think was their first month. And he's coming in here for some low back pain treatment and some hip treatment. A little bit of tightness, 5 out of 10 on the pain scale for the hips and the low back. It's kind of going around in the front and going around into the back too. This is his second adjustment here at the office. The first one went pretty well, and how long would you say you were like feeling pretty good in the gym afterwards?
It was, I'd say like immediately, as soon as I left the office, I felt great. I felt a huge difference.
Okay.
Especially in the hips and lower back area. I did legs that day, so I kind of went a little hard because I was like, oh, I just got adjusted.
Yeah.
But it lasted probably a good 2 days after that, because once the soreness hit, I was like, all right, now my hips and lower back are sore again.
Okay, and so now he's back. We're doing a follow-up visit. It's going to be really simple. We're going to do some muscle work on him, the adjustments, and we're going to do some extremity adjusting on him as well. We're going to start with you on your stomach here. Good. And first I'm going to do some work on the hamstrings. We're going to make sure we loosen these up because he's getting this tightness kind of into the hips and the low back, and this area is definitely going to be tight on someone who lifts as much as he does. How many days a week are you lifting weights?
Pretty much it's 4 on, 1 off, so pretty much like 6 days a week.
Okay. And how long have you been into weightlifting, like seriously?
I've been doing bodybuilding this way seriously for about 2 years now. Altogether, almost about 15.
Okay.
But competitive bodybuilding wise, about 2 years.
Okay.
And there is a big difference.
Yeah. No, competitive bodybuilding was way more serious than weightlifting.
Oh, for sure. I trained for my sports when I lifted, you know, so it's a big difference training for baseball and football than it would be training for bodybuilding competitions. So
Right. How's the pressure here?
Good, actually. If you want, you can always apply more. I'm great with pressure and pain.
All right.
And I know the more pain, the better.
Sometimes. I don't want to do too much in here. That's
Right.
for sure. Were you sore after the treatment?
Honestly, I wasn't.
Good.
No, not at all.
That's good.
The only soreness I might have felt was like the one where you did the glute one.
Yeah.
Where you dug into my glute and I kind of did like a swing with my leg. That one was painful.
Yeah. No, I remember that being kind of a lot. We're going to do that again today.
Yes, we definitely should.
That's a really good to loosen up the low back there.
I agree. That one helped me a lot, I think, if anything, the most, beside the twisting one. That one always does well for me.
Yeah, the low back adjustment.
Yes.
So now moving up to his glutes. This is more the glute max here, and we're going to do the glute med as well, and the piriformis. Going to make sure we do the QL like he was just talking about, and I'm going to get after his psoas, so we kind of do a full comprehensive treatment of the whole pelvic area where he's feeling this tightness. Did you feel any difference in your hips, like after the hip adjustment?
Yeah,
leg day?
my whole movement and range of motion was just so much better.
Good.
It was like 100% difference. I felt a lot more movement in my hips. I was able to, when I stretched later on, after my workout, I was able to actually get a deeper stretch as well, which is a great thing. You know, more range of motion always create more muscle. So for us, we're always trying to create more range of motion.
Yeah, when you have more range of motion, you're able to more effectively strengthen the area and get bigger muscle out of it. Yeah. Can't go very far if you can't move your elbow much. We'll try to do a bicep curl.
Right, exactly.
I like to use that as the most basic example.
That is the layman's term, if you will.
Yeah.
But yeah, I agree.
Did you lift today?
Yes, I actually did back.
Did back today, okay.
Yeah. Some rear delts. probably go back later and hit some traps and buys.
How often are you over at Powerhouse?
It depends. Like right now, they have me. They actually have more clients finally starting. I actually have a Monday at 10. But workout wise, I'm there every morning, pretty much doing my fasted cardio.
Right.
And then, depending on my day, sometimes I'll lift twice a day. I'll do one muscle group at the beginning of the day, and then another muscle group at the end. So usually about 2 to 3 times a day I'm there. And I'd say time-wise about 3 to 4 hours.
And so Powerhouse is 24 hours.
Correct.
But you don't personal train like outside, like you don't go in at crazy hours and train with clients, do you?
No. The only time I'll do like a personal session is like someone like her who is my client.
Right.
And she needs just a refresher or, you know, a new routine basically. And I'll go in, show her a new routine. What's that?
Okay.
But that's about as far as I go with that. Usually right now, anybody they have there, they kind of want me just doing their personal, and that's it.
Right.
They actually want me signing a contract as well, so. We'll see
Nice.
we'll see how that goes. I'm all about it. As long as it gets me some clients, you know?
Yep. So interesting working on Zach compared to other people because his muscles are so defined. You can really feel these knots, and you can feel like the individual hamstrings rather than just like a leg, which is kind of interesting. But these knots are just sliding underneath my arm here, my hand, and it just takes a pretty good amount of effort, let's say, to get these loosened up.
Oh yeah, I can imagine. There's ones in my lower back that are absolutely appalling. I don't even understand how they got there.
Good. And try to relax this here. Good. There we go. You got plans for the 4th?
I do, yeah. My, I guess, old manager now, technically, because I was working at the bar. I don't know if I told you I was working at Stonewood.
Yeah.
In Sparta, and they got shut down.
What happened with that?
I don't know. I guess something to do with the rent. They couldn't come up with a, I guess, reasonable payment. I don't know. It's
so
tough.
many restaurants have failed there.
Yeah, you know, I think it's the location, man. It's a tough location. It's sitting in kind of the middle of nowhere.
Yeah, well, pretty much all of Sussex County is like the middle of nowhere. But like that area, like specifically in Sparta, it's just like people say it's like cursed.
It's dead. It's like dead.
Yeah, but I mean, I really liked what they had going on there.
I did too.
I thought they were going to do really well. I was surprised.
Honestly, I was too. Because it was a great bar, and we had great people there. That's what kills me the most, is because I loved who I worked with.
Yeah. Alright, so we're going to do some adjusting here. You're going to go ahead and take a breath in, and then you're going to breathe out. And then here, in and out. And in and out here. And one more here. Good. Okay, let's go on your back, lay face up.
Oh. Jesus.
Alright.
My face is sweating.
Yeah. Well, the muscle work, it's not like a walk in the park for patients either, you know?
Oh,
especially
no.
when I dig in like I was for you.
Yeah, and especially the one where the leg, I start sweating like crazy.
It'll be your 3rd workout of the day.
Yeah.
Go ahead and breathe in and out. flat on your back and bend the right knee. So a lot of people like watching these videos that we do here for the cracks and the pops.
Mm-hmm.
And not a lot of people know what that actually is, like what's happening there. Go ahead and breathe in and out here. Good. Good. It's just gas leaving joints.
Yeah.
And that's all that is happening. Like when you crack your knuckles, it's the same thing. Go ahead and lay on your side, face away from me. And people will ask, like, oh, I thought cracking your knuckles was bad for you. Go ahead and bring this here and then up to here, okay? But if cracking your knuckles was bad for you, we're, cracking backs and necks, then basically our job is bad for you. So cracking your knuckles is okay. Just make sure there's no discomfort when you're doing it.
Right.
But yeah, it's very interesting to me that there's a lot of people out there who like to watch these videos and just hear the cracking sounds. There's some studies about the fact that the crack is associated with a relief, that it actually provides some sort of relief, like psychologically and mentally to people when they just hear the sound.
That makes sense.
Yeah.
That's like, you ever see the people that watch those pimple popping videos?
Yeah, I don't know. I am not into that.
No, some people are like addicted to it though. They're
Yeah.
like, oh, it's so cool. I'm like, no, it's really not. That's pretty gross.
It's pretty gross, but I guess whatever you're into.
Yeah.
I mean, pimple popping. I don't know if I could watch even like a couple seconds of those
Oh
videos.
God, my ex, she used to be into it. And she used to, every time she'd see a pimple on, she's like, oh, I gotta get that.
Like,
I'm
oh,
like,
man.
all right.
She wouldn't film it, would she?
No. No, I probably wouldn't let her if she didn't want to.
Do a couple more of these. Have you heard anything about Go-To Cola, the supplement, the herbal supplement for stretch marks?
No, Go-To Cola?
It's spelled G-O-T-U space K-O-L-A. And I'm only curious because like with lifting weights, like you must get
I do.
stretch marks, right?
Yes.
Relax this leg here. I only recently read about it. I think I read about it in Tim Ferriss's book.
Yeah.
And apparently you have to take it for like 6 months, like every day,
Really?
just to see any result. But it works awesome after that.
Huh.
I don't know. I
You know,
haven't started it yet.
I'm
curious about it.
I've always been curious about stuff like that too, because as a bodybuilder, like you said, it does happen because we put on size and we drop it. We put on size and we drop it. It's only inevitable that we're going to get stretch marks all over the place. A lot of bodybuilders don't really worry about it too much.
Really?
Only because when you're on stage and you have a spray tan, you don't see it.
Oh, okay.
So
is that like part of the reason why spray tans are done?
Between that and the fact that like you have to be very dark under the light, otherwise you'll just wash right out and you'll pretty much look like a ghost on stage.
Back and forth like this.
Our favorite one.
Your favorite one? So definitely digging in more on Zach than I do a typical patient, but he's right. He's got a big knot in here. Yeah, one more.
To be honest, I feel it all the time.
On your back, face up.
I feel it all the time when I'm on the elliptical.
Yeah.
I feel it like something in there, like rubbing. Something in there I hit, and it always causes me discomfort and pain.
And bring your knee up to chest and back down. What about on other cardio machines?
Yeah. Mostly on like a treadmill, I feel it more.
Okay.
Because there's more impact.
Right. And you feel it in your low back?
In my low back, yeah. And honestly, when I'm on the treadmill, I usually feel it mostly more in my lower back, or like when I'm just normally walking, I feel it in my lower back. But like when I'm on the elliptical, because I go higher, or I have a higher, I guess kick or whatever you want to call it, or a higher, I feel it in my hips.
And two more. So this is the glute med piriformis area. And relax this. Sometimes patients can get so tight that they get pain, numbness, tingling, even weakness into their legs. So loosening that muscle up is key in helping treat that. But with you, it's just general tightness and soreness in the area. So it's more of like a local benefit treatment.
Yeah. Well, that's what I kind of figured too. Like, I feel like this, or you know, proper stretching or doing it every day will eventually lessen the pain.
Oh yeah. You're gonna do your favorite one again.
Okay.
Go ahead.
Oh, this side's always worse, I feel like.
2 more. Good. On your back, face up.
I gave my all on that one. Oh, good God.
And relax this leg. And let it go heavy. Good. Go ahead and reset. And relax one more. So that's just a hip adjustment for him. Opens up the joint. And relax this knee here. Let the knee bend. Good. There you go. How's your neck doing?
Good. My neck is usually fine.
You want it adjusted at all, or?
Yeah, we could do that. Only time I really usually like doing it is because I do traps and we get sore in that area.
Right.
That's about the only reason I really do it. Once in a while I'll crack my neck myself.
Gotta be careful when you do that.
Yeah.
Cracking your neck yourself, not always the best idea. Let your head go heavy. Good. Have you ever seen a neck adjusted before, Jen?
No, I haven't seen it, no. I'm waiting to hear it.
And relax your head here. So checking range of motion, he goes this far this way, and then he kind of stops that direction. You may feel more tight going to the left than the right. He goes a ton that way. So a lot of it's on the right. So what we do is we adjust to get the motion restored into the joint. So relax your head, let it go heavy. Good. Good. And we check again, and now he moves further to the right versus the left. It's about the same now. Before it was like not moving that much. We go over here. Good. And one more way high. Relax it. Good. Little baby one there. So now when we check, he's that way, good. This way the same, and relax here.
Oh, I already feel less tight on that side.
Yeah. And even. Good. Okay, let's come up and see how you're feeling.
Oh.
Any motion that was bothering you before?
It honestly is just
Or was
a
just
world of
always
difference.
just...
I feel it already, not even standing up. Like my legs feel like, I don't know, like renewed.
Okay.
Yeah, see? It's literally a complete 100% difference. I'm not even joking.
Are you zero pain?
Zero.
Zero?
Zero. Like literally zero pain.
What about tightness?
Tight. No, I feel loose.
Good.
Really, really loose.
Good. All right.
It's such a huge difference, man.
Good.
You do great work, I'll tell you that.
It takes a little bit of time, but it's worth it.
It does, and it takes a lot of repetition, I feel like, with this too.
With what you do.
Right.
With people who don't work out as heavily, don't put the amount of stress in their body that you put in.
Yeah.
Like, what were you? You were like pressing like 1,100 pounds?
Like 1160?
Yeah, like a ton of weight. The
Literally
machine has like no more room for plates on it. So like, whereas some people who go in, they do their cardio, they're
Right.
doing some light lifting just to stay in shape. It's
Right.
a little bit different. So thanks for doing a video with me,
Yes,
Zach.
of
I really
course.
appreciate it.
Of course.
Thanks everyone for watching. I'm Dr. Will Holdsworth, your Sussex County chiropractor for Pain Relief Chiropractic. This is Zach. You can follow him at Zach Drake.
Zach.Drake_15 on Instagram.
Follow him. Follow some other bodybuilders too, especially if you don't work out, because it'll motivate you to get on track and start exercising. It worked for me. I've been working out consistently for 3.5 months. So get out to the gym. Do anything you can do to get more active. Thanks again for watching, everyone.